Lung cancer is often diagnosed at an advanced stage. In fact, your legs may have already given early warnings. There are 3 signs to look out for. Get screened early. Aunt Liu is 58 years old this year. After retiring, she lives in the city with her daughter. Her life is very regular. When she has nothing to do, she dances in the square downstairs in the community. About 3 months ago, Aunt Liu felt pain in her right leg from time to time. She went to the clinic at the entrance of the community for treatment. They said it was most likely osteoporosis and suggested she take more calcium. They also prescribed several bottles of calcium tablets. But after taking them for 2 months, the symptoms did not improve. Instead, they got worse and worse. It even affected her normal walking. Seeing this, her daughter quickly took Aunt Liu to the hospital for an examination. It was found that she had a suspicious bone tumor on her right femur. Further examination confirmed it was lung cancer. The pain in her leg was caused by bone metastasis from the lung cancer. This result was hard for Aunt Liu's family to accept. It was just leg pain caused by osteoporosis. How could it be lung cancer that had progressed to an advanced stage? Lung cancer is often diagnosed at an advanced stage. In fact, your legs may have already given early warnings. According to statistics, 1.4 million people worldwide die from lung cancer every year. In China, lung cancer has the highest incidence and mortality rates among all cancers. Moreover, 80% of lung cancer patients are diagnosed at a mid to advanced stage. Many prognoses are not ideal. Many people wonder, why is it that even with regular checkups, they are diagnosed at an advanced stage? Dr. Peng Jun, Deputy Chief Physician of Thoracic Surgery at the First People's Hospital of Yunnan Province, stated, "Routine X-rays can hardly detect early lung cancer. A CT scan is needed to detect early lung cancer lesions. Early-stage lung cancer has no obvious symptoms. When the tumor grows to a certain extent, compressing certain organs, there will be obvious symptoms such as coughing, shortness of breath, chest tightness, and sputum production. After developing lung cancer, 8% to 75% of patients will have cough symptoms. 20% to 49% of patients will have chest pain symptoms. 6% to 35% of patients will have hemoptysis, coughing up blood. 3% to 60% of patients will have chest tightness. 0% to 68% of patients will have unexplained weight loss. 0% to 2% of patients will have hoarseness. In addition to these typical symptoms, lung cancer can also cause the following leg abnormalities. Leg swelling. The development of cancer requires a lot of nutrients, causing low protein levels in lung cancer patients. When water moves into the interstitial space, it can cause leg swelling. In addition, cancer cells metastasizing and blocking lymphatic vessels can also cause local swelling. Leg color changes. Abnormal lung conditions can affect lung circulation, leading to body hypoxia and poor blood circulation. This can cause the skin of the legs to turn pale or blue. Leg pain. When lung cancer metastasizes to the bones or invades the blood vessels in the legs, it can cause insufficient blood supply locally, leading to leg pain. For unexplained and worsening leg pain, it is important to pay enough attention. Suggestion: certain groups should have annual CT scans to detect lung cancer early. Many young people are very conscious about cancer prevention. When they hear that low-dose spiral CT can screen for lung cancer, they think they should have an annual checkup. Dr. Qiao Guibin, Chief Physician of Thoracic Surgery at Guangdong Provincial People's Hospital, stated, "The radiation from low-dose spiral CT can also harm the body. Generally, 99% of young people are not at risk of lung cancer and do not need to undergo annual screenings. However, it is recommended that high-risk groups for lung cancer have an annual low-dose spiral CT scan to detect the disease early and treat it promptly. The following groups are considered high risk for lung cancer and should have regular screenings: people over 40 years old, people aged 50 to 70 with a history of smoking, people in special occupations such as asbestos workers, people with a family history of lung cancer, heavy smokers, those who smoke a pack a day for 20 years or 2 packs a day for 10 years, patients with chronic bronchitis, tuberculosis, asthma, and other lung diseases. Prevent lung cancer by taking good care of your lungs. Remember, 2 more, 1 less. Dr. Ding Huijin, Chief Physician of the Respiratory Department at the Affiliated Hospital of Yangzhou University, reminds us that preventing lung cancer is very important. To prevent lung cancer, you should follow these points. Drink more water. Drinking more water can promote blood circulation, better detoxify the body, and help maintain and protect lung health. It is recommended that each person drink 2,000 to 2,500 milliliters of water per day. Eat more white foods. In your diet, you can eat more white foods like lotus root, yam, and white fungus to moisturize and nourish the lungs, generate saliva, and quench thirst. Get angry less. Being frequently angry and emotionally upset can lead to alveolar expansion, resulting in chest tightness, shortness of breath, and rapid breathing, which over time can affect lung health. Therefore, it is important to avoid frequent anger and to maintain good lung health. Exercise before bed. Lift your legs for 15 minutes to promote blood circulation. Professor Li Xiaojun of the Basic Medical College of Beijing University of Chinese Medicine points out that you can spend 15 minutes at night before going to bed doing leg exercises. The movements are very simple. First, relax your body and lie flat on the bed. Place your hands folded under your navel, for fingers away. Lift your legs together. Bend your knees, and keep your lower legs parallel to the ground, with your thighs perpendicular to the bed. Hold this position for 2 to 5 minutes. Next, keep one leg straight while the other leg is vertical to the bed, holding for 2 to 5 minutes. Then switch sides. Finally, lift both legs perpendicular to the bed, crossing your ankles, and hold for 2 to 5 minutes. Don't underestimate these 3 movements. They can nourish the internal organs, promote blood circulation throughout the body, and strengthen the abdomen and legs, helping to reduce excess fat. This exercise is especially recommended for people who are prone to forgetfulness, as it can help train the mind and nourish the brain. It is also beneficial for people with rough skin, as it can help improve blood and oxygen supply to the skin. People who often experience numbness in their hands and feet are also recommended to do this exercise to improve blood circulation to the extremities and relieve numbness. Additionally, people who have blurry vision, a sallow complexion, insomnia, or frequent dreams can find some relief through this exercise. Conclusion: do not ignore abnormalities in your legs. Do not take for granted that leg abnormalities are caused by benign conditions. Seek medical attention promptly to determine the cause and receive targeted treatment. By taking preventive measures and having regular checkups, we can detect lung cancer early, improve treatment outcomes, and ensure a long and healthy life. That's all for today. Thank you for watching. We hope today's content has touched you. Don't forget to subscribe if you haven't already, so we can accompany you every day. Let's grow together, be happy together, and grow old together. See you next time.